How do labs analyze a kidney biopsy sample? Imagine a tiny piece of your kidney tissue being carefully examined to uncover clues about your health. That's what happens during a kidney biopsy analysis. First, the sample is collected using a needle inserted through the skin, guided by imaging, or during surgery. Once collected, it is placed on moist gauze to keep it from drying out and sent quickly to a specialized lab. In the lab, the tissue is preserved in a solution called formalin, which keeps its structure intact. Then it is sliced into very thin sections, often just a few micrometers thick, so it can be examined under a microscope. The first step is usually light microscopy, where a pathologist looks at the tissue to spot structural changes in parts like the glomeruli, tubules, and blood vessels. These changes can reveal signs of kidney disease or damage. Next, immunohistochemistry is used. This technique involves applying antibodies that attach to specific proteins in the tissue. It helps identify infections or particular types of kidney disease by highlighting certain cell markers. Similar to this is immunofluorescence, where fluorescent dyes are used to visualize these antibodies. This method is especially useful for detecting immune deposits, which are common in conditions like glomerulonephritis. For more detailed insights, electron microscopy is employed. It provides high-resolution images of the tissue's ultrastructure, revealing tiny details that light microscopes cannot see. This can help identify very subtle changes in the kidney's cells and structures, which are important for accurate diagnosis. Sometimes, additional techniques like in situ hybridization are used. This method uses labeled probes to detect specific DNA or RNA sequences, which can be helpful in identifying viral infections such as BK virus in transplant patients. Histochemical stains are also applied to highlight different tissue components, aiding in the diagnosis of specific conditions. All these analyses work together to help doctors understand what's happening inside the kidney. They can diagnose diseases like nephrotic syndrome or glomerulonephritis, monitor kidney transplants for signs of rejection, or determine if a tumor is cancerous. But it's important to remember that interpreting these results depends heavily on the patient's symptoms, medical history, and other test results. A kidney specialist, called a renal pathologist, combines all this information to give a clear diagnosis and guide treatment. If you or someone you know is undergoing a kidney biopsy, always consult healthcare professionals for personalized advice. The process is complex but vital for understanding kidney health and making informed medical decisions.